Over the last couple of years, FISH, which was based on purely a color scheme, has been replaced by 3 types of techniques, all of which are pretty much the same thing. They all can look at every single pair of chromosome. Microarray comparative genomic hybridization, or array comparative genomic hybridization. So MA, CGH, ACGH. And they're all pretty similar in terms of their approach, but they're able to take the cells and look at them more closely and more accurately. The approach can be used on a day 3 embryo, but then you still have the same problem with what you do to the embryo. If you wait for the embryos to first reach the stage where they have the best quality, so the blastocyst stage on day 5 or even 6 or even 7, cells can be taken from the trophectoderm, which is the outside layer of the embryo, so you don't disrupt the inner cell mass where the embryo actually resides. They can take several cells. So by taking several cells, they get more DNA, they're getting more information. It takes care of a problem called mosaicism, which in the cleaving embryo was a problem of one cell being taken and the one next to it being different. That kind of clears itself out by the later stage of development. And so that way the accuracy was better, the number of chromosomes that can be tested is better, and what even in our hands looked like a 15% error rate with the previous technique is down to probably 10% or less. We also found that the embryos that were judged to be normal certainly were normal. Embryos in the past that were judged to be abnormal may have actually been normal. So we may have been discarding some of the normal embryos because of the mosaicism and because of the way that they're being tested. Once the embryo has been biopsied, because it takes several days to get the results back, they all have to be frozen. So some people will say, oh my God, that's going to do them in too. But when you look at most places, frozen embryo transfer data, it's literally within percentage points of their fresh technique, largely because of vitrification, which is the new flash frozen quick freeze technique, where embryos coming out of the tank almost look as good as they did when they went in. So as we went from kind of a cruder method that still in the right hands had benefits, now the newer methods, which are actually in fewer people's hands because the technique is as complex as it is, that taking cells from the advanced embryo, so the only ones you're testing are the ones likely to implant, so that's a kind of a practical issue as well, testing them for all 23 pairs of chromosomes, freezing and then putting them back in a cycle where the woman hasn't gone through stimulation, which may actually be a better uterine environment. We're seeing implantation rates in our program over 60% for a single embryo, and an ongoing pregnancy rate that approximates 90%.